What is high blood pressure? Narrow blood vessels, also known as arteries, create more resistance for the flow of blood. The higher your blood pressure is, the narrower your arteries are. The pressure can cause health problems, including heart disease, over the long term. Hypertension treatment includes prescription medications and healthy lifestyle changes. Taking regular blood pressure measurements can help you and your doctor notice any changes in your blood pressure. How is high blood pressure diagnosed? High blood pressure usually doesn't have any signs. The only way to know if you have it is to get regular blood pressure checks. Your provider will use a stethoscope, blood pressure cuff, and a gauge. Before making a diagnosis, he or she will take 2 or more readings at separate appointments. The healthcare provider compares the blood pressure reading to what is normal for other kids of the same age, height, and gender. Your GI will need to take several readings over a period of time, usually every month, to see if your blood pressure is consistently high. Tests of blood and urine are also carried out in order to check for conditions known to cause an increase in blood pressure, such as kidney infections. You may also be given a blood pressure meter to take home to record your blood pressure levels throughout the day. Ask your doctor when you are next due for a checkup. High blood pressure hypertension. This is a serious illness that affects nearly 65 million adults in the US. When high blood pressure isn't treated, people can get sick or die. High blood pressure is often called a silent killer because many people have it but don't know about it. There are many medicines people can take to control their high blood pressure. The higher your blood pressure stays, the more risk you are. It's possible that your blood pressure is higher than 130/90 Mg. When you are pregnant, some women will have high blood pressure. This is called preeclampsia or thrombosis. Discuss your pressure with your doctor. High blood pressure during pregnancy. High blood pressure can be dangerous to both the baby and the birthing parent. Whoever becomes pregnant is more likely to develop complications from high blood pressure. Babies born to hypertensive birth parents may have a low birth weight or be born prematurely. Often the condition resolves itself after the birth of the baby. It is possible that developing hypertension during pregnancy increases the risk of developing hypertension later in life. While pregnant, some people develop hypertension. There is medication for the condition. How can I control my blood pressure? Lifestyle changes can make to help reduce high blood pressure include aiming for a healthy weight. High blood pressure can be reduced with moderate exercise such as walking or swimming. You should set goals so you can work up to at least 150 minutes per week. Check with your doctor before starting an exercise program if you have health problems that are not being treated. The health benefits of quitting can be seen at any age. Tell your doctor if you've been told you snore or sound like you stop breathing for a few moments while sleeping. These symptoms could be a sign of sleep apnea. A good night's sleep can help lower blood pressure and help with sleep apnea. In the same way that regular high blood pressure is treated, isolated systolic hypertension may require more than one type of blood pressure medication. You may try several kinds of combinations of medications before finding the best plan for you. Medication can control your blood pressure, but it can't cure it completely. Medication. Immediately consult your doctor for any of the following common side effects while taking medication for high blood pressure: dry cough, dizziness, faintness or lightheadedness, a skin rash, or headache. Different blood pressure medications work better for different ethnic groups. Examples of such ACE inhibitors are more effective as a first-choice medication for treating high blood pressure in white people, whereas calcium channel blockers or thiazide diuretics tend to work better for black people. Because black people have a lower level of renin in their blood, it is thought that this is a protein called renin regulates blood pressure. It is most effective when there is a high concentration of renin in the blood. Therefore, your doctor will consider your ethnicity when making a treatment plan. Thank you for watching. Do subscribe, like, and share.